going to be introduced into this country because it is these American health companies who are lobbying for these changes to be taking place. It's all driven by these corporate companies. It's not done in the interests of the patient. It's not putting the patient at the centre of care. It's putting the corporate body, corporate organisations at the centre. They are driving this agenda, as they do with all kinds of other provisions. Look at railways, same thing.
Actually, it hasn't been a bad thing for the consumer, but it needs to be done properly. And the railways, yes, you're quite right. There were problems in the way the railways were nationalised.
Okay, so if we transfer to the NHS, to have it done properly, what would that mean? To have privatisation done properly in the NHS? What do you mean by that?
Well, I'm not talking about privatisation of the NHS. You're talking about privatisation of the NHS. That's not something that I've.
But that is clearly what the NHS is moving towards.
I think what the NHS is moving towards is a situation where you've got a greater range of providers who will be there, who will have that ability to provide the care, to provide the treatment that patients need. If you know, you widen the choice and make more options available to patients, then you are going to address that capacity issue that you spoke of earlier.
Well, you've got overcapacity.
Well, in which case it's easier for.
Money.
So you don't agree with the French system then, where they pump?
No, I don't.
No, okay.
It was. I mean, 1948.
It was the most efficient system
Most
in the world.
cheapest.
There's more
That's right, the
percentage
cheapest.
of overhead in the world.
Exactly.
About 4 or 5%.
Well, people say the country's in a bad way now, nothing like it was in 1948.
Yeah, that was a true age of austerity.
That's right, that's right. And that was introduced as the most efficient, cost-effective system. And it's proved its worth for over half a century until I agree with you, it was the Labour Party who started to break it up and bring in private providers. That's quite right. But what's going to happen?
The NHS isn't available in one situation to provide that treatment. I think that patient would quite happily go to another provider.
Why should it not be available? It should be available, that's the point. It should be universally available.
I agree, but you're not always going to be able to deliver that to the NHS. It's
why
always been
Nobody wants this change, but it's the American health companies that have lobbied him of this system. And we need some backbone shown here by MPs. We need some resistance against the whips. And we, instead of following blanket policy, we need some individualism here, because I know you want to, because you're worried you'll be deselected, but you're far more likely to be elected if you show some spirit and backbone.
Well, let me just say, I take what you're saying, but I don't agree with it. I would not vote for this bill unless I thought it was the right thing to do, and the reason that it's the right thing to do is because we have a massively ageing population. The number of over 65s in Norfolk alone is going to double in the next 20 years. It's going to be a troubling time for the NHS for the reasons I've just given.
Why? We've got billions and billions and billions in the pockets of the rich and the people not paying tax.
And real terms funding for the NHS is going to go up over the next few years.
How many times have I heard that? It's bullshit.
Not true. That is not true.
How many times have we heard that from different colours?
Well,
you can say it with a straight face, with a smile on your face. It's ridiculous.
It's not true.
I think I've had a chance to listen to all the concerns that people had to raise.
Well, no, I don't think you're listening to your constituents. We are your constituents. We are telling you.
That's what I'm here for.
Yes, I know, but you just keep saying, I don't agree with you. You do think, we keep trying to tell you we're worried about the NHS. We're not.
And I would urge you, please, any more comments that you want to make, to contact me, to put it in letters, to put it in an email,
and you'll write
to call my office, and I will look into it.
Yeah.
But yes,
but you won't. But you're not going to change your mind, are you?
Sorry?
You're not going to change your mind.
Whether you agree with this bill or not is irrelevant, because you are there to represent your constituents. The majority of your constituents are against it.
Yeah.
Right?
The majority of Britain's against it.
Yeah.
Well, I don't know what the evidence is for that, but
the evidence is there in opinion polls, so they've been done.
When was the last time someone came to your surgery and said they really liked the idea?
Well, I mean, come on, we can have a debate about the role of political representation and whether or not I should just go along with what the majority says. Frankly, I think on issues like capital punishment, I'm quite glad I don't go along with the majority opinion, and I will do my best to represent what I think is the right thing, but at the same time listen to the concerns that are out there, and I will take those concerns up with ministers. So please, I must get on now, because I've run much over.
It was created in times of great austerity, and it was created because it was the most cost-effective and efficient way of providing a universal healthcare system. We are told these are now times of great austerity again, therefore why not return to the NHS as introduced 60 years ago. Instead of that, what we're getting is fragmentation of a unified system, because it has to be broken up so it can be sold off piecemeal to private providers. Private providers operate in the interests of their shareholders primarily. Private healthcare companies in the US make money, insurance companies in the US make money by not providing healthcare but by denying it. That's how they make their money. So in the US you have to take out health insurance, but most people can't afford enough health insurance, so they're underinsured. They are insured, they pay premiums, but they're underinsured. Now when they need hospital treatment, they find the bill is more than their insurance company will pay. They have to top it up. They can't afford to top it up, so they have to sell their homes and they're living on the streets. They are bankrupt because of the American healthcare system. This is what is in store for us if we allow this, what is privatisation, to go ahead. Fragmentation, privatisation. It will be a system which is hugely expensive to run because of the complexity of it. The transaction costs will be massive. In the US, they're reckoned to be 30% of the healthcare budget. That's what we will approach. When the NHS was set up, and for the first 50 odd years, the running costs were 5% of the budget. 5%, nothing. So money is going to be poured into running the system, not allocated to treating people who are ill. And that is absolute madness, absolute madness. So we don't want that to happen. That's why we're here now. What we have to try to do is make people aware of what's about to hit them, because I think still people don't know. But we have to get the message out there somehow.
This government is pursuing a misguided approach that it thinks that making cutbacks to public services is the answer to the economic problems. Well, we know what we need to be doing is keeping people in work and creating a fairer and greener society for the future. But I would argue that even on the government's own terms, the proposals for the NHS are misguided. I think they're financially misguided, as Bill has said, and I think they'll result in a worse service for NHS patients, which of course is the vast majority. We know that, as Bill said, the amount of money within the NHS that's been spent on internal markets, on admin, has risen enormously in recent decades under the privatisation and internal markets we saw in the major years, worsened severely under Blair and Brown with all the money spent on private finance initiatives, and will be worsened even further now under this government. We're not going to see private companies coming in and offering to run the most expensive or the most difficult NHS services. The services they're going to be interested in running are the ones that are easiest to run or the ones that are cheaper. And that's where I think that Simon was wrong with the comments he was making before. He was highlighting, which is right, that there's lots of places in the country where people don't have access to the NHS services that they need. But if we see private companies coming forward, they're going to be trying to run the services that are most profitable, leaving the NHS under greater financial strain running the remaining services. And given that the Secretary of State will no longer have an obligation to ensure universal provision, I'm really concerned that it's going to increase the postcode lottery and not reduce it, as well as bringing in a further profit motive to the way services are run, reducing quality of care for patients and wasting more money on the internal market. I think that we should be proud to say that we want to stand by the founding principles of the NHS, that it's free at the point of delivery, universal to all, and as well as being a publicly funded service, it's a publicly provided service where we're proud to provide it in the most efficient way. So let's keep on campaigning, let's keep on urging Simon and other MPs to change their mind and lobby the House of Lords over the next few weeks. Thanks very much.